Okay, imagine the scenario. You're a vet, an animal comes in, and it's just off, you know? Lethargic, maybe losing weight, could even have diarrhea. Seems simple on the surface, right? But underneath, it's often this whole tangled web of possibilities, and the stakes incredibly high, especially if it's a young animal.
Definitely. It's a common situation, but the complexity can be really daunting.
So today we're doing a deep dive into enteritis. That's basically inflammation of the intestines. But here's the twist. We're focusing on how it plays out very differently in two specific animal families. First, Camelidae, think camels, llamas, alpacas. And second, Cervidae, so deer and elk.
Right. Two distinct groups.
We've dug into some comprehensive vet guides, looked at the research, our mission, to really unpack the causes, how the illness looks in each group, because it is different, and crucially, how vets tackle diagnosis, treatment, and maybe most importantly, prevention.
Yeah, prevention is huge.
By the end, you'll get not just what enteritis is, but why it demands such, well, fundamentally different thinking for these fascinating animals.
It's actually a perfect example of how context changes everything in veterinary medicine. Same basic problem, inflamed gut, but the strategy completely different depending on the species and the situation.
So it's a great way to put it. So let's establish a baseline. Enteritis, as you said, intestinal inflammation.
Simple definition.
And our sources are clear. It can be caused by a whole range of things: viruses, bacteria, parasites, lots of infectious agents.
And it's often serious.
Yeah.
Can lead to severe illness, even death, especially hitting the young ones or animals whose immune systems are compromised.
Okay, and here's where our sources say it gets really interesting. The core philosophical divide, you could call it.
Exactly. Because while diarrhea might be a common sign you see, the whole approach for camelids versus cervids, worlds apart.
So for a llama or an alpaca, if they get enteritis, it's usually treated as an individual animal's crisis, right?
Precisely. The focus is tight on that one animal. What specific bug is causing this? What's the best treatment plan just for them?
But then you shift to farmed deer or elk.
And bam! It's often a herd-level catastrophe. An outbreak isn't just one sick deer. It's frequently tied back to broader management issues.
Like feed or stress or density.
All of those. So you need a population-based strategy. You're thinking about the whole group, not just treating individuals one by one.
Yeah.
It's just not feasible, often.
That really highlights how scale changes the game in veterinary work.
It absolutely does. One size fits all just doesn't work here.
Okay, so let's dig into that difference more. We'll start with the camelids, llamas, and alpacas, and that individual focus.
All right. So general context for camelids.
Mm.
Diarrhea in a healthy adult. Actually pretty uncommon.
But when you do see it, especially in crias, that's the term for young camelids or maybe in adults under stress or with weak immunity.
Then it's serious.
Yeah.
Very serious. Needs urgent attention.
And our sources highlight one parasite in particular as being, well, a really big deal.
Ah, yes. You're probably thinking of Eimeria macusiniensis.
That's the one.
It's arguably the most significant cause of parasitic enteritis in camelids. And critically, it affects them at all ages.
What makes it so dangerous?
Well, it doesn't just hang out on the surface. It invades deep into the intestinal lining, causes severe inflammation, major protein loss.
That sounds bad.
It is. And that damage can even set the stage for secondary bacterial infections, like clostridial diseases, which are often fatal.
Okay, but here's something our sources stress that seems really challenging. The diagnosis. The signs are often vague.
Extremely vague. That's the crux of the problem. You might see weight loss, lethargy, maybe what vets call ill thrift, just not doing well.
But not necessarily diarrhea.
Right. Diarrhea is actually an inconsistent finding, especially in adults, which, seems counterintuitive for enteritis.
So how do vets figure it out then, if the main sign isn't always there?
That's the million-dollar question. It's incredibly tricky because this parasite has a long pre-patent period.
Pre-patent period.
Yeah, that's the time between the animal getting infected and when the parasite starts shedding eggs or oocysts in the feces, which is what we normally look for in a fecal test. For E. macusiniensis, this period is long, like 35 to 43 days. So an animal can be getting really, really sick with major gut damage happening before there's any sign of the parasite in a fecal sample.
Wow, so the damage is already done before you can even confirm it.
Often, yes, which is why vets frequently have to resort to what's called empirical treatment.
Meaning?
Meaning they treat based on a strong suspicion, the clinical signs, the animal's history, the risk factors, even without that definitive lab confirmation. It's a judgment call based on experience.
Sounds like high-stakes detective work.
Yeah,
Okay, so beyond E. McCusinensis, what other bugs are causing trouble in camelids? Other parasites?
definitely. There are other smaller coccidia, different Eimeria species like llamas and alpacas. These tend to hit younger crias, especially around weaning when they're stressed.
Makes sense.
Then you've got things like Cryptosporidium, Giardia, and don't forget the worms, particularly blood feeders like Haemonchus contortus. That one causes anemia, protein loss. You might see that classic swelling under the jaw, bottle jaw.
Got it. What about viruses?
Viruses are definitely in the mix, especially for young ones with diarrhea. Our sources flag coronavirus and rotavirus as the most common culprits found in diarrhea crias.
Coronavirus seems particularly prevalent.
Yeah, studies have found it in a high percentage of cases. It can affect crias from, say, 10 days old up to around 150 days.
And there was another one mentioned as emerging, BVDV.
Bovine viral diarrhea virus. Yes, that's becoming a bigger concern. Interestingly, alpacas seem more susceptible than llamas.
And the issue is PI crias.
Persistently infected crias. They're born with the virus and shed it constantly, acting as a major source of infection for others. Makes biosecurity absolutely critical.
Okay, viruses, parasites. What about bacteria?
Bacterial causes are important too. E. coli, specifically the toxin-producing kind called E-tech, is a big one for really severe diarrhea in newborns.
Neonatal diarrhea, right.
Exactly. Then you have Salmonella species. Yersinia pseudotuberculosis can cause problems too. And for the adults, you have to consider John's disease.
Ah, John's. That's caused by Mycobacterium avium paratuberculosis.
That's the one. It causes this chronic wasting enteritis. It's progressive, untreatable, and ultimately fatal. A really tough one.
But it's not always an infection-causing diarrhea, is it?
Good point. No. Sometimes it's non-infectious. Sudden diet changes can trigger it. Stress is a big factor. Weaning, transport, new environments.
Right.
And sometimes in really young crias, there's this mild temporary diarrhea called a substrate purge, just as their gut adjusts to milk. Usually passes quickly.
So with all these potential causes and focusing on the individual animal, what does control and management look like for camelids?
It has to be multi-pronged. Robust parasite control is essential. That means regular fecal exams, strategic deworming.
Not just guessing.
No, definitely not. Strict sanitation is key, keeping feed and water clean, minimizing fecal contamination. Biosecurity, as we mentioned with BVDV, is huge. Quarantining new animals, testing them before they mix with the main group.
And if an animal does get sick?
Then prompt. Supportive care is vital.
Yeah.
Fluids, electrolytes, nutritional support, keeping them warm, whatever it takes to help them through the crisis.
And the diagnostic tools vets use, beyond just looking at the animal.
Well, fecal analysis is big flotation to find eggs, maybe PCR tests for specific DNA of pathogens. Blood work is crucial too, checking protein levels, hydration status, signs of inflammation.
And sometimes imaging.
Yeah, abdominal ultrasound can be really helpful to actually look at the intestines, see if they're thickened or inflamed, check lymph nodes. Gives you a look inside without surgery.
Okay, that paints a clear picture for the individual focus in camelids. Now, let's flip the script. Let's talk cervids, farmed deer, and elk.
Right, and here the mindset shifts dramatically.
Because in farmed deer, enteritis often means sudden death.
Sadly, yes. Enteritis and sudden death are frequently linked, and it's almost always tied back to the intensity of the farming practices.
And you mentioned deer are good at hiding illness.
Incredibly good. It's a prey animal instinct. Don't show weakness. So by the time an owner or manager notices something is wrong, the disease is often really advanced.
Makes treating individuals tough.
Very tough, sometimes impossible. The window of opportunity can be incredibly small.
And our sources pointed to one specific, often devastating threat in farmed deer, Clostridium perfringens.
Ah, yes, enterotoxemia. It's described as highly fatal. Often presents as sudden death animals found dead that seemed perfectly fine, maybe even in great body condition, just hours earlier. It's heartbreaking for farmers.
What triggers it? It seems so sudden.
The classic trigger is a sudden increase in dietary carbohydrates.
Like changing feed too quickly, or a sudden overload of grain.
Exactly. That sudden influx of carbs allows Clostridium perfringens, which is often normally present in gut in small numbers, to just explode in population.
And then it releases toxins.
Potent toxins, and these toxins cause massive damage to the intestines. If they do a necropsy, a post-mortem exam, the findings are usually pretty dramatic.
What do they see?
Often segments of the small intestine that are severely hemorrhagic, necrotic, basically dead, bleeding tissue. Vets sometimes call it bloody gut. You might also see excess fluid in the chest or abdomen. It's a grim picture.
Wow. Okay, so that's a huge threat. What other bacteria cause problems in cervids?
Yersinia pseudotuberculosis is another major one. Causes yersiniosis.
We heard about that in camelids too.
We did. In deer, it's a big cause of gastroenteritis and sudden death. Outbreaks are often linked to stressors, transport, bad weather, overcrowding. Stress is a huge trigger for Yersinia.
What else?
E. coli is a major issue for young fawns, causing rapid, often fatal diarrhea in their first week. Salmonella can cause enteritis too, typically with really foul-smelling diarrhea.
And John's disease again?
Yep, John's, caused by Mycobacterium avium paratuberculosis, affects deer too, leading to that chronic wasting. It's a slow burn compared to something like enterotoxemia.
What about viruses in deer and elk?
Several are significant. Hemorrhagic disease, which includes EHD and blue tongue viruses, is a big one.
Transmitted by midges.
Biting midges, yeah. It causes widespread hemorrhages internally, and you can see bloody diarrhea as a result. Then there's malignant catarrhal fever, or MCF.
That sounds nasty.
It is. Very severe, often fatal in deer, can cause dysentery, among other signs. And like in camelids, rotavirus and coronavirus are also recognized causes of enteritis in cervids.
Parasites must be an issue too, with animals often grouped together.
Absolutely. Heavy loads of gutworms, nematodes, and coccidia, those Eimeria species again, can cause major production losses. You'll see diarrhea, poor growth, especially in younger deer.
And it's not just infections causing gut problems in deer, is it? Management plays a big role.
A huge role. Our sources really emphasize this for cervids. Gastrointestinal ulcers, for instance, are surprisingly common.
Ulcers? From what?
Strongly linked to stress. Handling stress, overcrowding, social instability within the herd. Inappropriate diets are another major factor contributing to gut issues.
So the takeaway is that as you intensify deer farming, if you don't have preventative measures nailed down,
losses due to disease are likely to rise significantly if it puts immense pressure on getting the management right.
Which leads to the control strategy. If treating individuals is often off the table,
then prevention at the herd level becomes everything. That's the entire focus for cervids.
And vaccination is key.
Critical. Especially vaccination against those clostridial diseases, like the one causing enterotoxemia. Our sources call it a highly effective, essential tool for deer farms. A real game changer.
What else besides vaccines?
Basic but vital stuff. Good sanitation, clean feed, clean water.
Yeah.
Avoiding overcrowding is essential. Biosecurity to prevent bringing new diseases in.
And managing parasites.
Yep. Regular fecal testing to monitor worm burdens, checking if dewormers are actually working. Strategic treatment based on that monitoring.
And you mentioned stress multiple times.
Reducing stress is paramount. That means thinking about everything.
Yeah.
Low stress handling techniques, good facility design that allows animals to move calmly, trying to maintain stable social groups. It can make a massive difference for diseases like yersiniosis and those stress-induced ulcers.
So if there is a problem, like sudden deaths, how do they figure out what's going on at the herd level?
Necropsy, post-mortem examination. It's often the most crucial diagnostic tool when you have a herd problem like unexplained deaths or widespread diarrhea.
To get definitive answers for the group.
Exactly. It tells you what you're dealing with. Was it like enterotoxemia?
Yeah.
Yersiniosis? Something else. That information is vital to guide strategies to protect the rest of the herd. It's detective work, but for the whole population.
Okay, this has been fascinating, tracing the parallels and the really stark differences. So let's zoom out. What does this all mean for you, the listener? Why should you care about llama guts versus deer guts?
Well, the core takeaway, really, is understanding that profound difference we keep coming back to, addressing enteritis as an individual animal's crisis in camelids.
Versus a herd-level catastrophe in cervids.
Precisely. It's not just about slightly different symptoms. It's a complete pivot in veterinary thinking, how resources are allocated, even the economics of it all.
And I think this deep dive really showcases the incredible specificity needed in veterinary medicine. How the same basic sign, like diarrhea, can point to vastly different problems needing totally unique approaches depending on the species.
Absolutely. And it also shines a huge spotlight on the role of human management. Diet, stress, hygiene, how many animals are kept together. These factors are powerful drivers in either preventing or, unfortunately, sometimes triggering really severe diseases.
It underscores the detective work, doesn't it? How vets piece together clues.
Subtle clues, lab results, maybe the stark evidence from a necropsy, combining all that with deep knowledge to protect health, whether it's one cherished alpaca or a whole herd of deer.
And as those veterinary guides consistently remind us, while knowing the causes and treatments is vital,
The real key, especially in populations, is mastering prevention. Biosecurity, hygiene, smart management, those are the tools that really control infectious diseases effectively in both contexts.
So maybe a final thought to leave you with. If we take this individual versus herd perspective, this idea that scale changes the whole approach, where else might that apply?
Oh, interesting question.
Yeah. What other areas, maybe completely outside animal health, have problems that look similar on the surface, but might need fundamentally different solutions depending on whether you're looking at one instance or a massive system-wide issue?
That's definitely something to chew on. How scale shifts strategy,
Yeah.
not just in vet med, but maybe in public health or policy or even technology rollout.
Exactly. Something to think about. Keep that curiosity going. Keep exploring how environment, stress, and health all connect. We'll catch you on the next deep dive.